Hello, this is Dr. Ryan Bell. I'm a pediatrician with Yada Yada Health, here to discuss another common pediatric issue. For the next little bit, let's talk about constipation. It's a really common problem that we deal with in our practice, to the point that anybody that comes in complaining of abdominal pain, constipation is really the first thing that goes to the top of the list. It's extremely common. Symptoms can be anywhere from really mild to severe, even to the point of mimicking appendicitis. Your child can be doubled over in pain, screaming and crying in the middle of the night, and the cause might be constipation. There's a whole other discussion to have about other causes of abdominal pain in kids, but the one we'll focus on today will be constipation. First of all, so some important things to think about with your child, their diet. So if we've got a picky eater, we're more likely to be constipated. If we have kids that eat a lot of carbs, we're more likely to be constipated. Probably the most common foods we see, especially in young kids, that can be problematic would be dairy, especially cheeses, and bananas tend to be big constipators. So if your child's suffering from constipation or you're worried about it, try to do less dairy, less cheese, fewer bananas. And then on the flip side of that, the foods that can be super helpful will be your prunes, apples, and pears. Fiber and whole grains can be helpful. Drinking more liquids can be somewhat helpful, but usually people kind of overvalue the role of fluids. A lot of water, things that people drink when they think they're constipated, actually gets absorbed in the small intestine and never makes it to where it's going to be very helpful. Your fruits, so your prunes, apples, and pears, are helpful because they have a sugar that will stay in your child's system all the way through to where it can draw water in, can loosen that stool, and help stimulate bowel movements. So really focus on those things as far as diet goes. The second thing that I would really encourage if you think your child has constipation would be to get some Miralax. So Miralax comes as a powder, comes in a big bottle. You can do large amounts of Miralax if you need to. I usually start at about a teaspoon per year of age and then quickly go up on those doses. You can start at once a day, you can go to twice a day, you can go to 3 times a day if you need to. If we have kids that need to be cleaned out for a surgical procedure like a colonoscopy, we'll have kids do up to 7 or 8 capfuls in a day, depending on their age. So don't be shy about using Miralax and using bigger doses if it's not working. Really the only side effect that we see commonly from Miralax is that some kids will get some cramping. If you do too much Miralax, you're going to get diarrhea, which in the big scheme of things is probably a good thing, at least initially, and then you can really back down on the amount of Miralax that you're doing. Kids that really get backed up and have a lot of stool impacted there need a really aggressive bowel clean out that can go on for a day or two. Talk to your medical provider and get some input on the way to approach that. Once they're cleaned out good and you're getting brown or tea-colored liquid drainage from their bowels, then you go more into a maintenance mode where a lot of kids need to continue doing some small amount of Miralax or some large amount of Miralax for some kids for up to 6 months. The reason for that is, say your colon is this diameter to start with. When it fills with stool, it has a reflex that will want to poop that stool out. So the colon is responsive. Once you get constipated and you get stool backed up there and you get big and dilated, then the colon tends to be floppy and it's not as responsive and not as functional. And so once we clear that stool out, you've got a big floppy colon that needs to have time to shrink back down to a normal size. So give it a good 6 months, and then hopefully at that point you can transition off of laxatives. Some kids continue to need some amount of help pooping for years and years at a time. So use it if you need it. We always worry that as kids start to get constipated and it hurts when they poop, that they decide they don't want to poop anymore. And so then they withhold their stools. Those stools get bigger, they get harder, they're more painful when they poop, and it just reinforces that idea that pooping hurts and they don't want to do it anymore. So really try to be proactive, keep constipation at the top of your list if your child's having belly pain, and try that basic approach.